The Doctor Who quietly saved millions. True story of Ignaz Semmelweis. In the middle of the 19th century, walking into a hospital was often more dangerous than staying at home. For women about to give birth, hospitals were places of fear. Many survived the pain of labor, only to fall sick days later and die. Doctors did not understand why this was happening. There was no clear cause, no visible wound, and no explanation that made sense at the time. This is not a fictional story. It is a true historical account, and it centers on one quiet doctor whose careful observations would eventually save millions of lives. His name was Ignaz Philipp Semmelweis. He was born on July 1st, 1818, in the city of Buda, which is now part of Budapest, Hungary. At that time, the region was part of the Austrian Empire. Semmelweis studied medicine at the University of Vienna, one of Europe's most respected medical institutions. In 1844, he earned his medical degree. Soon after, he began working as an assistant physician in the obstetrics clinic at the Vienna General Hospital. This hospital was well known and highly regarded. Yet inside its maternity wards, something deeply troubling was taking place. Childbed fever, also known as puerperal fever, was claiming the lives of countless mothers. Women who appeared healthy after giving birth would suddenly develop high fevers, severe pain, and infection. Many of them died within days. Doctors had theories, but no real answers. Some blamed bad air. Others blamed overcrowding, weather, or fate. Most believed the deaths were unavoidable. Semmelweis was not satisfied with those explanations. As he worked in the maternity wards, he noticed something strange. The hospital had two separate clinics. One was staffed by doctors and medical students. The other was run by midwives. The difference between them was striking. In the doctor's clinic, death from childbed fever was far more common. In some months, mothers died at 2 or even 3 times the rate seen in the midwife's clinic. This difference troubled Semmelweis deeply. He began to study everything. He examined patient records. He compared procedures. He looked at ventilation, crowding, and seasonal changes. But nothing explained why one clinic was so much deadlier than the other. Then, in 1847, something happened that changed his thinking forever. A close friend and colleague of Semmelweis, a man named Jakob Kolečka, died after being accidentally cut with a scalpel during an autopsy. The symptoms of his illness were horrifyingly familiar. They looked almost exactly like those of women who died from childbed fever. This realization stopped Semmelweis in his tracks. He began to wonder if doctors themselves were unknowingly spreading disease. At that time, bacteria and germs had not yet been discovered. No one knew that invisible organisms could cause infection. But Semmelweis suspected that something unseen was being carried on doctors' hands. Doctors and medical students regularly performed autopsies on dead bodies. Then, without washing properly, they examined living mothers. Semmelweis believed that harmful particles from cadavers were being transferred from hands to patients. To test this idea, he introduced a simple rule. All doctors and medical students were required to wash their hands with a chlorinated lime solution before examining patients, especially after leaving the autopsy room. The results were immediate and dramatic. Within months, deaths in the doctor's clinic dropped sharply. Where mortality rates had once reached nearly 18%, they fell to as low as 1 or 2%. Women who would have died were now surviving. This was not a small improvement. It was a transformation. For one of the first times in medical history, a doctor had identified a specific cause of disease transmission and successfully prevented it. Yet instead of praise, Semmelweis faced resistance. Many doctors were offended. The idea that their own hands were killing patients was deeply unsettling. Without an understanding of germs, hand washing seemed unnecessary and insulting. Medical societies rejected his conclusions. Senior physicians dismissed him. Some refused to wash their hands at all. Despite clear evidence and statistics, the medical establishment resisted change. Semmelweis continued his work. In 1850, he returned to Hungary and began working at another hospital. Once again, he enforced strict hand hygiene, and once again, mortality rates fell. In 1855, he became a professor of obstetrics at the University of Pest. He trained students and continued to advocate for hand washing, but acceptance outside Hungary remained limited. In 1861, Semmelweis published a major book explaining his findings on childbed fever. Even then, many doctors dismissed it. Some criticized his writing style. Others simply could not accept his conclusions. Years of rejection took a heavy toll on his mental health. In the final years of his life, Semmelweis struggled deeply. He experienced periods of depression and unusual behavior. In 1865, at the age of 47, he was committed to a mental institution outside Vienna. During his confinement, he resisted. He was beaten by guards and suffered serious injuries. 2 weeks later, he died from blood poisoning, the same kind of infection he had spent his life trying to prevent. At the time of his death, he was largely unknown. Few people attended his funeral. Years later, science finally caught up. The discovery of germ theory proved that invisible organisms cause infection. Antiseptic practices became standard in medicine. Semmelweis's insight was finally understood and accepted. Today, hand hygiene is a foundation of modern healthcare. Every hospital teaches it. Every medical professional follows it. Millions of lives have been saved because of the principle he introduced. Ignaz Semmelweis did not live to see his ideas accepted, but his quiet observation changed the world. A simple act, performed every day, reshaped medicine forever.